Morning, Miss Huntley. My name's Hannah Huntley. I'm going to be your student nurse from University of Memphis. How are you?
Fine.
Okay, can I see your name and confirm your full name and date of birth?
Brandy Huntley, 2876.
Okay, wonderful. So today we're going to test your musculoskeletal and your neurologic system. So first I'm going to go ahead and ask you a few questions to help determine your orientation. So if you could restate your full name for me.
Brandy Huntley.
Okay, and if you could tell me where you are right now.
The doctor's office.
Okay, great. And can you tell me what day of the week it is?
Thursday,
And today's date with the month and the year?
April 16th, 2020.
Okay, great. So patient is alert and oriented to person, place, and time. So I'm going to go ahead and look at your pupils. So if you can take your glasses off for me and look straight ahead. Okay, pupils have a resting size of 4 millimeters and are round and equal bilaterally. I'm going to go ahead and darken the room where I can look at your pupils with some light shining into them. So if you just look straight ahead again for me. And the other eye. Okay, great. So pupils are equal, round, reactive to light bilaterally with a resting size in both eyes of 4 millimeters and a constricted size of 3 millimeters when faced with consensual light. Okay. So next, I'm going to go ahead and test your hand grip strength. So if you can squeeze my fingers as hard as they go on both sides. Okay, you can stop. Hand grip strength is strong and equal bilaterally. Now we're going to do the same thing with your feet. So if you want to go ahead and lay down, that'll give you extra support. And you're going to put the soles of your feet against my hands and push as hard as you can. Okay, heel push is strong and equal bilaterally. So now I'm going to inspect your spine. So if you could sit back up for me. And I'm going to go ahead and inspect your cervical spine, starting with the anterior portion. And I'm going to look at posterior. Pull that down where I can see that better. Okay, you can stand up for me. And normally I would ask the patient to take their shirt or their gown off, but for privacy purposes, we're just going to verbalize the findings we would see if the shirt was not on. Okay, if you could bend over and touch your toes for me. And come back up slowly. Okay, upon examination of the spinal processes are straight and have proper alignment. The cervical and lumbar spines have the appropriate concave curves, and there is no kyphosis or scoliosis inspected. Upon the bend to touch the toes, the patient's spine switches from a concave curve to a convex curve as expected, and then goes back to the original expected concave curve upon standing. There is no lateral curvature of the spine through any of those, which is as to be expected. Okay, so now I'm going to go ahead, I'm going to palpate your spine starting with your cervical processes. Let me know if any of it's tender. Okay, was any of that tender for you?
No.
Do you have any pain?
No.
Okay, so upon palpation of the spine, the spinal processes once again appear straight and aligned. No spasms occurred during the palpation, and the patient reports no tenderness or pain upon the palpation as well. Okay, so next we're going to go ahead and examine some of your muscles. So while you're already standing, I'm going to go ahead and examine those trapezius muscles. Okay, you can go ahead and sit down for me. And if you could do your your arms like this one at a time where I can check those biceps and triceps. Okay, if you could do the other arm. Okay, and if you could lift your pant legs where I can look at the quadriceps and the calf muscles. Turn your calf over. So upon inspection of the trapezius, biceps, triceps, quadriceps, and calf muscles, they have the appropriate color as expected for ethnicity symmetrically. They are symmetrical in size and contour upon inspection. I did not see any redness, swelling, or deformities or lesions bilaterally as well. And the color is as expected for ethnicity. Okay, so next I'm going to do the same thing, but I'm going to do it with your joints. So I'm going to go ahead and start with those shoulders. I'm going to do the anterior shoulder first. Okay, if I can look at your posterior shoulder. Okay, I can see your elbows. Okay, I can see your wrists, your fingers. Okay, and I'm going to go ahead and look at your knees and your ankles while you're sitting, and then I'll have you stand up and I can look at your hips. Turn these where you can see your ankle on all sides. Okay, if you stand up, I'm going to look at those hips. Okay, and back down. So upon inspection of the shoulder, elbow, wrist, finger, hip, knee, and ankle joints, the joints are symmetrical in size and contour, as well as having an appropriate color for ethnicity expected bilaterally, and I did not see any redness, swelling, or signs of deformity bilaterally as well. Okay, so I'm going to go ahead and I'm going to palpate those muscles. So I'm going to go ahead and start with your trapezius muscles. I'm going to do your biceps and triceps. I'm going to do one hand on your bicep and one on your tricep. Okay, so I can do your other arm. Okay, I'm going to do your quadriceps and your calf muscles. Okay, so upon palpation of the trapezius, bicep, tricep, quadricep, and calf muscles, did you have any pain or anything or tenderness?
No.
Okay, so no pain or tenderness was palpated, no heat was palpated upon my examination. There also were no masses palpated, and they were symmetrical in size and firmness bilaterally as well. Okay, so now we're going to go ahead and do the same thing with your joints. So I'm going to start with your anterior shoulder. And same thing in your posterior shoulder. Okay, I'm going to do your elbows. I'm going to ask that you hold your hand out like this and put your elbow at about a 70-degree angle. Okay, repeat the other one. Okay, I'm going to do your wrists bilaterally. Okay, next your fingers. Okay, now I'm going to go ahead and do your knees and your ankles while you're sitting, and then I'll do your hips when I get you to stand, okay? So I'm going to start about 10 centimeters above the patellar region. Okay, and then do your ankles bilaterally. And if you could pull those down and stand up for me, and I'm going to do your hips now. Okay, do you have any pain or tenderness at all while I was palpating?
No.
Okay, so there, upon the palpation of the shoulders, elbows, wrists, fingers, hips, knees, and ankles, there was no tenderness, pain. I didn't palpate any heated areas. I didn't palpate any swelling or masses, and they were symmetrical in size and symmetry and firmness bilaterally as well. Okay, so next I'm going to have you work your neck through some ranges of motion for me. So I'm going to look at the anterior side first, and then I'm going to have you turn around right to the posterior side. So I'm going to have you look up at the ceiling for me, and tuck your chin to your chest. I'm going to have you touch your ear to your shoulder, touch your other ear to your other shoulder, and then have you look both ways for me. Okay, and you can turn around and do the same things. I'm going to move your hair slightly where I can see. Okay, if you could look up for the ceiling for me. Okay, you could tuck your chin to your chest. You could touch your ear to one of your shoulders and do the same on the opposite side. And if you could look both ways for me. Okay, do you have any pain or anything upon any of those movements?
No.
Okay, so the head and neck were able to be worked through the full range of motion of flexion, extension, rotation, as well as lateral bending. Okay, so now I'm going to have you turn around and we're going to work those shoulders through full range of motion. So we're going to start off, we're going to just raise your arms straight above your head. And we're going to keep them like that. We're going to bring them back down, swing them behind your back in one fluid motion. Okay, now we're going to put your arms to your side and raise them up over your head like a tent. Okay, now we're going to bring them back down. We're going to bring our right arm across our body, and we're going to slowly bring it back. Okay, we do the same with left hand, bring it across our body, bring it back. And we're going to bend our elbows and put your hands above your hips. And we're going to do the same thing, keeping our elbows out and put our hands behind our hip. Okay, do you have any pain on any of those movements? No. Okay, so the shoulders were able to be worked through the full range of motion of flexion, extension, hyperextension, external rotation, internal rotation, as well as abduction and adduction. So now we're going to test the range of motion of your hips, so you can lay down and get comfortable over there for me. Okay, So we're gonna start off, and I'm gonna have you raise one leg at a time over to above your head. And the other leg. Okay. Next, I'm gonna have you bend one knee at a time and bring it up towards your chest like this. Okay, now if you'll take one leg at a time, swing it away from your body and swing it back towards your body. Okay, now we're going to bend one knee and we're going to bring it to your opposite leg. Okay, you can do the same with the other leg. Okay, great. Now we're going to bend one knee and we're going to put the opposite ankle on top of that knee. And you're gonna let the leg that has your ankle on top of the knee fall away. Okay, you can do that with the other leg. Okay, did you have any pain with any of those?
No.
Okay, now if you could roll over on your stomach for me, you're gonna put your leg up in the air as straight behind you as you can, one at a time. Did you feel any pain with that?
No.
Okay, you can go ahead and roll back over on your back then. So upon the range of motion of the hip was able to be worked through the full range of motion of flexion, extension, hyperextension, abduction, adduction, as well as external and internal rotation. And so overall, we had a patient who is alert, oriented to person, place, and time. We had pupils that were round, equal, reactive to light bilaterally, with a resting size of 4 millimeters each and a constrictive size of 3 millimeters each when presented with the consensual light reflex of the pen light. When we went and inspected and palpated the spine, we had no kyphosis or scoliosis. We didn't have any lateral curvature. We had the expected concave curve of the cervical and lumbar spine when sitting and standing. The lumbar spine switched to the appropriate convex curve upon asking the patient to bend down and touch her toes, which then switched back to the concave upon standing as expected. In addition, with the hand grip and pedal push, we noticed that the grip on both sets of extremities was strong and equal bilaterally, and with the inspection of and palpation of the trapezius, bicep, tricep, quadricep, and calf muscles, we noticed that there were no masses, that they were symmetrical in size, contour, and firmness. They did not have any lesions, redness, heat, tenderness, swelling, or deformities bilaterally as well. And then when we went in and did the full range of, we were able to get a full range of motion from the neck and cervical spine area, as we saw with the flexion, extension, rotation, and lateral bending of the neck. We were able to work the shoulders through the full range of motion of flexion, extension, hyperextension, external and internal rotation, as well as abduction and adduction. And the hips were able to be worked through the full range of motion of flexion, extension, hyperextension, abduction, adduction, external rotation, and internal rotation. All of the range of motion exercises were done without pain or tenderness to the patient. Is there anything else you need before I